notification prior. I think I'm just waiting for it to load. There's a few more people trickling in. So great. Welcome everyone to another webinar of Mind the Bleeps FY1, preparing for FY1 series. Today, Anya has kindly agreed to give us a talk on well-being, which I think is a really important and kind of often overlooked topic as we transition from a medical student to an FY1 doctor. So that's great. So before we get started with her talk, I'm just going to show you a quick 5-minute video from the BMA. And they've got an offer for incoming FY1s of 3 months of free membership if you join the BMA through their offer today. So I'm just going to share the video with you so we can watch this while we wait for the rest of the students to join. Can you see my window? Yeah, there you go.
Hi guys, from the BMA here. So I'm just going to talk to you a little bit today about the BMA membership and how we can help in your F1. So firstly, you'll see on the screen, we've got a bit of an offer for you. If you use that QR code that's on the screen, you'll get your first 3 months of membership free if you're not already a membership. If you're already a student, you don't need to worry, that carries through and it upgrades to an F1 membership when we get GMC number through. So if you're not, scan that QR code and it will follow the form through as if you're a final year. Don't join as an F1 just yet, but it will be upgraded to an F1 membership. Doesn't mean you'll miss out on anything. So use that QR code, and then if you want me to double check that you've got the 3 months free, you can drop me an email at dtyler@bma.org.uk afterwards, and I'll just make sure that's gone through. So we'll crack on and we'll talk a bit about BMA membership and an update on strikes. I'm sure you'll know what the BMA is and what it does generally, but as a bit of a reminder, we are your trade union national association. We sometimes get some confusion with indemnity companies, so UMPS, but the fact is we do something completely different to those companies. They deal with the clinical side of things, insurance, patient needs, whereas we deal with the non-clinical side, so things like your pay, your entitlements, and your support. Most doctors are members of the BMA membership at nearly 200,000 doctors and med students nationwide, and it's worth remembering that we only deal with doctors and medical students. So the burning issue at the moment, of course, is your pay, and we need you guys coming through into F1 to continue the fight. Your cohort, of course, stands to gain the most from this, so please do join the BMA and continue alongside the current juniors in fighting for better pay. So this is where we are at the moment. Things are working despite us not agreeing to any particular offers. The government keeps saying this is the final offer, and we've seen another increase. So we've done incredibly well without entertaining any offers, but it's important that we keep going and we stick together. So to continue our mandate to strike, we held another reballot back in April, and these were the results. So we now have a mandate to strike through till 19th of September. So this obviously includes you guys. If you were to start, it's in August, and we call a strike, you guys would now be able to strike if you're in membership. So just as an update on the strikes, you know, recently after talks that we were having sort of May, June came to nothing. We announced strikes from 27th of June, ending today, 2nd of July. This is a pretty strong message I hope we're sending out to what's going to be the incoming government, and we just want to be at the forefront of people's minds that we are still here and we do still have the power. This was a full walkout, so a 5-day full walkout. So yes, hopefully it's had the desired effect and brought this issue to the forefront of people's minds once again. It's important to say, you guys coming in as F1s, any offers, anything that's negotiated from the government from now on will be put to you to vote on. So nothing will get decided just by us. This is purely a membership thing. So any pay offers that we get from now on will be put to you as junior doctors, and you'll get to vote on whether to accept those offers or not. Another key thing to talk about is protection whilst being on strike. Obviously, we're encouraging all juniors to go on strike as when we're going on strike. But as this is us announcing a date, as this is the BMA putting these strikes on, we do encourage you to be in membership. You have a form of protection from us if you're in membership. If you go on strike and you're not with the BMA, there's nothing necessarily we can do to protect you. So yeah, always better to be in membership when you're on strike. Just to cover other things, the consultants agreed to their second deal. So they were put together a first deal, which they rejected. The second deal, they voted on and accepted. 82% of the consultants voted yes on that. And more recently, the SAS doctors agreed to their second deal as well, end of June. Members voting yes to accept that pay offer, so 79%. So it can be done, and this only ends when we as a collective, when you guys vote on an offer that you'll accept. Just to step outside the pay dispute for now, there's lots of things that we can help you with during your F1. Some of the frequently asked questions we get on the screen. We have BMA staff on the ground at each trust who know inside out, so we'll always be able to help you, and we usually resolve things pretty quickly. It's not uncommon, sadly, in the NHS for there to be issues, so it's good to have a support call to go to if needed. And you can get in touch with us anytime via our website, and you'll be put in touch with your local BMA staff if further support and help is needed. So this is a very important slide. You'll see the figure there. Last year, 25% of the contracts that we checked did not comply with the national model. So we negotiate all the doctor contracts in the UK, obviously including the F1 contract. So you may know we had a contract checking service. This year, ahead of inductions, we're doing things a little bit differently. We are going to ask all trusts for the contracts that are going out to the F1s, F2s, and we're looking at those templates before they get to you. So hopefully this year we'll nip it in the bud. But if you do get your contracts and you do see issues and you remember, you can still send it to us, and we will still check it. But we're hoping to bring that figure down. We're not saying that trusts give contracts out wrongly on purpose, but 25% is too high a number, and obviously, we were looking at contracts in the thousands, so 25% is just not good enough. We've also got a road checking tool, so that one you can go online, put in your rota in our website, our road checking tool on our website, and it'll flag up if it's wrong or not, and then you can get in touch with us and we can help sort that out. Other resources you get as part of BMA membership include access to the BMA library, which offers you thousands of ebooks and journals. You also have full access to Clinical Key, which you may have used during medical school, so there's no paywalls there, you just get complete access to that. We run a series of webinars as well, which may be useful to you. You can watch those live or watch them back online as they're recorded. You've also got full access to BMJ Learning, and you'll get a copy of the BMJ through the post. If you're already a membership and you're not getting your BMJ, please do get in touch with us, and we'll make sure that it starts getting sent out to you every week. We've got a great tool for exploring your specialty options. So it's an online psychometric test, which takes about 20 minutes to complete. It'll ask all sorts of work-life balance questions, and then at the end, it'll give you a breakdown of what specialties will suit you according to the answers you've given. Good to do it now, and then sort of a couple of months into F1, and then just start thinking about what specialties you want to go into. So this can help you really make a good decision when it comes to that. Thanks for listening, and just as I said at the start, if you're not already a membership, do take advantage of this offer to get 3 months of membership free. It'll be from the date that you use this QR code, so do it today. The latest that you can do this is the 18th of August, but ahead of inductions coming up, please do it sooner rather than later. Use that QR code, follow the membership form through. Do still join as a final year, and we will link up your GMC number as and when the GMC send it over to us. So sign up as a final year for now, and you will get all the benefits of F1 membership anyway. If you'd like me to check that you've got the 3 months free, you can drop me an email on dtyler@bma.org.uk, and I'll just make sure this has gone through. It's 3 months free. Thanks for listening, and good luck with your F1.
Great, thanks everyone for your patience. And then, Anya, if you'd like to start the talk, that'd be fantastic.
Great. Let me just share screen. Oh, hold on. Okay, that seems to be Okay. Right. Can everyone see that? And also hear me?
Yeah, it's all good. You can see me here.
Right. Okay. So my name's Anya. I'm a F3 at the moment. I'm not sure if you guys are kind of applying, getting into F1 this August, or you're already in F1 in foundation training already. But this is something that's really important, and you're going to have probably lots of talks about well-being at some point. But I think it was something we always forget to do, and often we have the talks and don't really kind of pay that much attention to it. So regardless if you're still in medical school or you're in foundation training, it's really important to be aware of it. So we'll go through a couple of things. They all really tie in together, really, different aspects of well-being, things that you can do at work and even when you're still in medical school, which will really help with your overall well-being. And at the end, I've just got some extra resources, some things for you to, in your spare time, have a look at and see, if there's anything there that's really helpful for you. So, just general introduction. The World Health Organization have sort of done the definition of well-being, and they've said it's a positive state experienced by individuals and societies, and it encompasses a quality of life and the ability of people and societies to contribute to the world with a sense of meaning and purpose. So I don't think we say that to each other when we say, how are you doing? But I think well-being means different things to everybody, and to some people it might be being able to have that kind of decompression after a shift or a day doing lectures. It may be just phoning your family or friends, maybe having, a meaningful day at work, having that conversation with that family member or patient, and kind of getting that from your work as well. So it means lots of different things to different people, and really it's kind of, we will want you to kind of reflect on what's helpful to you and what you could hopefully get something out of the lecture today about it. So tying into well-being, something that we don't get a lot of is breaks, and then something we do tend to get a lot of is sometimes, unfortunately, burnout. So I thought it was important to talk about these things because they will be when you're training and when you're in your foundation year, something you'll come across. So it's not classified as a medical condition in the ICD or DSM, but the World Health Organization has classified it as a syndrome of symptoms, and they put it across 3 different areas, really. So the first one is, do you get any feelings of exhaustion, fatigue, and then also feel that you're having this mental distance from your job or your studies, and or even potentially these feelings of negativity towards that and being cynical, and then that in itself impacting your efficacy in work. And it can mean different things. A lot of people throw the terms around of resilience, but I think also have to bear in mind that the NHS isn't as it was many years ago, and we're working in a health system that's under pressure, and we've got the tensions of rising patient demand, understaffing, difficulties with the rota, and I think it can be quite easy to blame yourself for feeling, I'm just not resilient enough in this job. And people cope with things differently, and I don't think it's being nice to yourself. It's not productive to blame yourself when you feel that you might be getting these feelings. And it's the same in medical school, because the amount of work you have to do and all the exams, it can be quite overwhelming sometimes. And I'd say mostly all of the people I met had feelings like this at some point, but that doesn't mean that it's entirely your fault. And I really just kind of want to highlight that. They did a national training survey, so a bit of background with the GMC a couple of years ago, and they found that 39% of junior doctors reported burnout at some point. 51% described their work as emotionally exhausting, and 66% reported they had always or often felt worn out. These are quite staggering figures, and I think it's also just to reassure you, if you do get feelings like this, that you're not the only one. That it is unfortunately more common than it should be. And really, with the system that we're in, there are some things that you haven't got much control over, and it's difficulty in accepting that sometimes, but also having a look at, are there any things that we can reflect and look on to help our own well-being when we're in conditions like this as well. So the BMA, so we had that lovely intro about joining the BMA. So if you're not already a member, highly recommend it. They're fantastic. They've got so many resources and they're always available for support and advice over a wide range of things. But they've also got lots of things on burnout as well. And they've got a particular questionnaire that I thought would be interesting. It's a lot longer, but I thought we'd do a couple of questions. Now, if you're in med school, relate it to your studies, but if you're already in foundation training, and have a think about it. You're more than welcome to say out loud what you feel, to type it, or if you just want to keep it to yourself, that's more than happy for you to do that. Okay, so first question would be, do you find new and interesting aspects in your work? And whether you agree, do you really agree? Do you find that, I don't work at the moment, finding lots of new things, I'm finding it really interesting, or actually, no, things are, not that interesting, they're getting quite boring, I'm not finding anything that's, motivating me. And then the next question, there are days when I feel tired before I arrive at work, and how you feel about that. So my sleep schedule isn't the best at the moment, so I imagine probably quite a lot of people would say they feel tired, but other things we can look at for that as well. And how do you feel about that? Do you get enough sleep? Are you, no matter how much sleep you get, exhausted all the time? And then question 3, you're finding that more and more often you're talking about work in a negative way. So are you finding when you're in work, when you're outside of work, that you're struggling to talk about it in a positive light? You're finding more negativity? And just have a think about that. And is that relevant to you at all? So even being medical school, you're finding that when you chat to your friends about it, there isn't very much positive things you can say. And then the next question, after work, I tend to need more time in the past than I have previously in order to relax and feel better. So sometimes, when you come back, you might just need a bit of time to, rest and relax. You might be watching something, you might be going out for a run. But are you now maybe finding that you need more of those activities to get to that same baseline you normally are? And whether that is true for you at all. And then the last one is, I can tolerate the pressure of my work very well. And I think this is an important one, and it sometimes can be a bit of a signifier if you're not coping, or your well-being suffering at work or medical school. If you think back to a couple of months ago, were you able to cope with this scenario probably quite well? Did you have enough support? And now this time you're finding that your pressure point is a bit lower, that you're struggling than you did before. Is there a change in that? And that can be normal with every external, internal factors, but it's something I keep an eye on as well. Lovely. And if anyone's got any questions at all, just you can put it in the chat, you can talk whatever you guys want to do, that's fine as well. I found this really nice quote from one of the BMJ articles about burnout, and it kind of struck me a bit like, obviously when you go and take flights, they always say, if you've got someone who's vulnerable and needs help, that you put your oxygen mask on first before you then help someone else put theirs on. And it's I think quite important to remember that when you're in medicine, because good medical practice, the patient is always the center of everything, but it's also good medical practice to look after yourself and to know if you're able to look after the patient. And if you're not looking after yourself, you won't be able to do that effectively or efficiently either. And we do need a change in culture for asking for help and support. I think, over time it's been getting a bit better. There's a lot more kind of openness about it. So, chatting to your colleagues, if you're struggling, or, even your seniors, there's more there and they're more understanding of it. And I think the really important thing is not to be afraid to ask for help. So if you think things are more challenging than normal, or you're concerned that you might be burning out, there's always someone there to talk to you about things, and there's not to be afraid to ask for help with that. And that could literally just be your colleagues, it could be your family, your friends. If you've got a really nice senior or supervisor that would be willing to listen, just let someone know, because sometimes even just talking about it and then realizing they're also struggling just helps you both, really, because it can often be quite easy to feel like you're alone and the only one who's feeling this way. And that kind of ties into being kind to yourself. And it's really easy to be because this career that you're in, it's going to be all about perfectionism, getting everything right. So then when you're not feeling your best, you're going to tend to be mean to yourself. And I think we all do it to some extent. But knowing, okay, maybe doing this isn't, the best thing for me with regards to the way I talk to myself, or maybe I'll take this day and I'll do something for myself instead of going and doing this or whatever. And that also ties into setting boundaries. So with not sort of outside of work as well, but particularly in work, it can be quite difficult, especially when you start out as an F1. I find that, you want to do as much as you can, you want to do everything that nurses are asking you, but you're going to exhaust yourself if you try and get everything done. And it's important to understand when, you've got to say, actually, I've got to look after myself here. This isn't something that's urgent. It doesn't need doing right now. I need to go and have my break, or I need to, I'm going to hand it over instead. And over time, some people are just sometimes very good at this. But I think I struggled when I started at F1, because you're like, oh, it's okay, it'll just take me 5 minutes, but it will snowball if you do that, and you end up leaving about an hour late sometimes. So, and I think it's something you can use in all aspects of your life as well. And that, is also sort of the work-life balance. It's the trigger words they use in all wellbeing lectures. I'm sorry, I've had to put it in, but it's something that can be really difficult to get right, and that is kind of tying into trying to leave work on time. And I think we'll go into it a bit later, but working on prioritizing and your handovers, so that you also look after yourself and that you're not leaving an hour late every day, because you may not feel like it at the time, but over time it's gonna wear you down, and then you're gonna start to feel burnt out. But also say, try and find some things outside of work, which is crazy. In medical school, I imagine it was just all exams, placements, but actually finding something that you enjoy and trying to do that outside of work and keep it up. Or if there was anything you used to do before med school, try and see if you can rework it into your life again. And like I said before, seeking support with your family, your friends, even your colleagues, or if it is thinking that actually there needs to be something more immediately done about it, talking to your seniors or supervisor about it. And there's a couple of things else we'll talk about as well that can be helpful, but kind of a general gist is just, I think, being able to reflect a bit more on what you're like or feeling about work, to kind of give you an idea before you get to a stage where you are burnt out, that things need to change, or you need to get some help, or at least chat to someone. That leads to breaks. I'd say, definitely when I was an F1, I'd be like, no, I'm not going to take the break. I'm going to just do this one, discharge letter. I'll just quickly go and see this patient, and then I'll have a break. But I'll tell you now that you'll never get your break if you do that, because something else will happen, and someone will become acutely unwell, and you've got to go review them, and then it's like 4 p.m. and you're haggard because you're really tired. You've not had a single break yet, and you haven't drunk any water, and you you end the shift feeling absolutely exhausted. So then you don't go out and see your friends that evening, or you don't go and, you know, do that little 10-minute run or whatever. So I think if you've got a chance to take a break, I highly recommend that you take it. You will at some point do as we all do, but at the end you do regret it when you're absolutely exhausted. I'm taking this from the BMA, so they've done the recommended breaks that you should be getting for your shifts. I think sometimes it can be difficult to, especially for 12-hour shifts, get that amount of break, but that is what they're advocating for anyway, and what you should legally be trying to get. So just whatever you can get, take it when you can, especially when you're on call and ward cover, because you may not get another break. And this was mentioned in the beginning, but checking your rota. So I remember I got my first rota, I was like, oh my gosh, well, particularly Wales has got a different contract to England, and I was working there at the time, and I think I was rostered for like 10 days in a row, and I was like, how is this possible? Like, this does not fit. But the BMA will do a rota check for you. So as long as you're a member, it's completely free. You enter in all your shifts and they make sure it's compliant. And it just takes that little bit of extra stress off you as well. And then if it isn't compliant, like they said it was 25%, you've got someone there that's back, you know, in your corner to help you make sure that you're not exceeding the number of hours you should be working. So I always recommend doing that. So even if it looks okay, I always just check my rota, because it's just a bit of peace of mind, because the rota coordinators aren't going to check it for you, and you're the ones that are going to have to do the shift. So I would highly recommend doing that. Oh yeah, dealing with difficult colleagues. I'd love to say that this would never happen, but unfortunately it does, and it can mean, like, with the factors working in the NHS in the high pressure job, everyone's got their own priorities and plans, and especially seniors as well sometimes. So it will be inevitable, but it's about trying to reframe it when it happens and how to try and deal with it, really. A couple of things. I think the main thing here is that any form of bullying, harassment, abuse should never be tolerated, and that should be escalated. That is not, you should never be on the hands of that, okay? And if you have, I highly recommend you speak to someone about it, because that's just not okay at all. I think also knowing in your team who you can go for support. So I know, for example, you've gone downstairs for radiology, you've gone through a handful of forms, and, you know, they've been a bit difficult about it, and you come back, you have a little bit of a rant, you know, you feel a bit better when you've talked to someone about it. So even if it's a colleague, thinking about the person you have a disagreement with, and ultimately there's going to be external, internal things happening there. They've got some personal issues. We've all got sort of stories we're telling ourselves in our heads as well that influences the way that we respond and communicate with each other. So, you know, it could be a miscommunication, but again, that doesn't excuse their poor behaviour if there is difficulties with them. If there's a chance of de-escalating it when having the conversation, it's all about trying to take a step back, look at how you're responding to it and how they're responding. If it's not going to go anywhere and it's just getting worse, I'd say sort of step back. If you're able and feel comfortable enough, then you can, and when things have cooled down, have a chat with them later and rediscuss it, and be like, you know, or can we have a chat about what happened earlier this morning? You know, we were discussing this and I felt like things got a little bit out of hand, and I think could tell we were frustrated. If you feel that is appropriate with the type of person you were talking to, I'd also recommend you have someone else there, but there is always mediation, and, you know, it's not uncommon that you have to unfortunately get your seniors involved, and they will have a chat, and sometimes you'll have a chat with them as well. So there's someone else there to ensure that it doesn't get out of hand and you're not treated unfairly as well. But I'd say, I mean, I'd hope that the bullying, harassment and things is rare. I've not seeing that at all, but it's just to be aware of that it can happen and it's not your fault as well, and to seek support if it does. Leading into debriefing, something you'll do a lot. It can be, you may not even realise you're doing it. I find mostly you'd be doing it sort of after cardiac arrests, or I've just treated a really unwell patient, and afterwards I'd have a chat with the reg or the cardiac arrest team and just sort of go through it, what we did, what happened at the end, was there anything that we could have done differently. I've often done it if I've had a big family meeting and I've got some colleagues in there. I have a chat with them afterwards, say, how did you feel it went? Was there anything I could have said differently? Did you feel that was there anything that would have changed it, or and I think it's important as well, if you feel that one of your colleagues has just struggled with something difficult, that you see if they're happy to chat about it. We often use it, when teaching med students, when you're like, okay, how did you feel it go? How did you feel it went? And what would you think you'd do differently next time? What have you learned? I think it's an important thing, and it helps us learn and reflect on things. And you could even use it at the end of the day in work if you think there was anything in particular that you're like, actually, I need to have a chat about that, and just kind of see it from someone else's view as well. And it is hopefully there to provide a safe learning environment for you. And also, with these cardiac arrest debriefs, it does improve your teamwork. I felt it was all usually beneficial. But I think there's also needs to be a disclaimer, really, because sometimes people can be still quite distressed for something that's happened, and debriefing is sort of kind of re-exposing sometimes to that traumatic event, and that can have the potential to cause more harm. So, try and be mindful of that, and don't insist that someone debriefs if they're not feeling like they can. So, buzzword again, work-life balance. We've touched on a couple of these already. I'd say handover, the hardest thing to do when you start. I think there was many late shifts before you get the hang of it, really. I'm just take a quick drink, sorry. So, especially if you're on wards, it's gone 5 o'clock, you've still got a list of things to chase, or non-urgent jobs. Have a chat with your colleague if there's anything that they're also needing to hand over. If there's anything that it's gone 5 o'clock, if there isn't anything urgent that needs doing literally now or that evening and can wait till tomorrow, you just have to think, okay, is this best now just to leave it till the morning? And I'd recommend that you just sort of, I find it difficult not to get everything done in my head, but you have to kind of let it go and say it's better that I have this sort of rest from work and I come back refreshed and do it the next day. If there are things that need handing over, sometimes there are like tasks that would just be a lot easier for you to do much quicker. Sometimes I will stay a little bit later just to sort that out, but so the on-call team don't spend like an hour doing some neurosurgical referral and things like that. But every other time, the ward cover team, the on-call team, they're being paid there to work that time. So you need to hand over things, and you do get better at it. I think it's also important that with handovers, you're saying the appropriate information as well, so whoever's being handed over to can adequately take that information and use it appropriately. That kind of like discussed before about boundaries, and being able to try and say no when people say, oh, can you just quickly look at this ingrown toenail at 5:05, and a lot of people will be like, oh yeah, it'll take 5-10 minutes, but you'll, like I said, it will snowball into something else if you stay. If no one is acutely unwell and you haven't got anything to hand over, just leave while you can. And like I said, prioritizing. So you will just have some terrible days. Sometimes nothing will go your way. You will get half of your jobs done. I find looking at the list, reprioritizing what I need doing, seeing if I can split the jobs with anyone else in my team, and just, you know, cutting the losses and saying, all right, these things aren't urgent. Let's just get these things done today, and then that's still a win, because you can't predict how days are going to go, and being harsh on yourself about not getting them all done isn't going to help. Talking about breaks, we talked about breaks. Again, just making yourself feel as refreshed as you can through the shift. So making sure you get some water. I think we've all got acute kidney injuries walking around on the ward. So try your best to keep yourself hydrated. And with on calls, if you've got any snacks you can hide in your scrubs, because you might be on the other side of the hospital when it's time for your break, and then suddenly the rest goes. So try everything you can to just keep yourself as fresh as you can and rested. With leave, I would say when you get your rota, try and plan your leave as soon as you can, so that the rota coordinators have got enough time. And if you do need to make swaps, you've got enough time to arrange that. I'd say as well, take advantage of your study leave. You get more study leave in your F2. I think you can maybe get a day of study leave in F1. They might have changed it, but use it. And I know if you're studying for any exams, if you want to go to any conferences, you've also got kind of like some things to look forward to there. And with your annual leave, when I was working in some places you're doing like 7 days in a row, I'd always try and get, you know, that day off after, just to get a bit of rest as well, rather than back in. And touching on the same thing before, having a life outside of work, it's going to be really difficult sometimes. But like it's just finding things. If you know there are some things that you enjoy, like literally it's stuff like video games, crocheting, anything literally that can help you just keep your mind a little bit of a rest. Any form of exercise, literally a 2-minute stroll is better than nothing. And chatting to your friends and family and anyone around, it'd be really helpful. And we say this to all our patients about sleep, diet, exercise, but we're terrible at it ourselves. You know, sleep hygiene, you know, phones at night. I think we're all terrible at this. You try and get some form of healthy diet if you can, and any form of exercise. It just trying to, like, little things that you know you could tweak that aren't really massive overhaul changes to your life. I think it's really good to just start somewhere small. And try and incorporate that as much as you can. It won't dramatically change things, and it just over time just helps, you know, with you and your well-being, and you've got something to fall back on if you've had a particularly bad day. And yeah, I've been asked to talk about less than full time. I did that a bit too quickly then. There you go. So it's been changing the past couple of years. It's becoming a lot more popular, and they're incorporating it a lot more now, and it's become much easier to apply for. And you know, it's quite good for improving your work-life balance. If you want to do any extra things like PG-CITs and medical education on the side, or any other interests. So it's like there's some people who are like Olympians who've had the time to go and pursue that as well. They've introduced an annual allowance if you do go less than full time of £1,000. I believe that's at least England. I'm not sure about the rest of the UK. And there's a minimum of 50% less than full time, so you can't go any lower than that. I think there's a maximum of 80% in England, and I think Wales do allow 90%, so that would literally be 4.5 days a week. And it will then inevitably mean you'll have a longer training time, but it's available if you want to do it in your F1 or also in your F2. And then also, obviously, like core medical training, GP as well. That's something you can do. So they've recently changed it. So they used to have 2 categories that you could apply for. So if you had it for, you know, caring for someone or for ill health, but now they've changed it. So they've done kind of a various number of reasons. So you can basically apply it for any reason now at the moment that you could be appropriate enough for. And important to note, you can also locum, but you'll need to put that on your Form R at the end, I believe, at least for the NHS England. There are variable application deadlines and windows. So for Wales, I believe it's twice a year you can apply to have less than full-time training, but for Health Education England, it's at least 16 weeks notice. So I just suggest, if you're wanting to start it or you're looking into it, that you just get in contact and see when the application deadlines are, and start having a look as soon as you can. So these are the reasons they've got for requesting. So there's quite a lot there. The first category used to be disability or ill health, caring responsibilities, but now it's included things like welfare and well-being. So you could just literally say, for my well-being, for my welfare, I want to work one day less a week, and that is now accepted, which is fantastic. Sorry, I've got a little bit of a sore throat. And then they've expanded it to include religious commitments, unique opportunities like Olympians, even non-medical developments, other qualifications, even like management courses, law courses, even fine arts courses. You could say, I want to go do this a couple of days a week, and they'd be happy with that. And the other main reason is flexibility. So you could say, you want this flexibility to enable yourself to develop a broad career portfolio. They would accept that now. So it is a really, it's a new thing they're developing and trialing, but I think it's something that maybe a lot of people will be doing in the future, and particularly GPs. A lot of them are less than full time. Only really GPs in training are working 5 days a week now, but you also do have GPs with special interests, so they're using the rest of the week to do different things. And I just thought it'd be good to put some resources here. So a couple of them has already been discussed before, but the BMA, fantastic. So there are trade union and professional body for doctors. I've left the hyperlink there for you to have a look, but it's literally just on their website. If you're feeling like you need some extra support, you need to chat to someone, there are counselling and peer support services available. So the counselling is a free counsellor therapy sessions of up to 6, about 50 minutes each. And that is available for you to have if you feel you need it. And then there's also peer support services. So sometimes you just actually want to speak to another doctor, and that is also a free service that they have available. And they've got a free confidential 24/7 counselling line, which is fantastic. And I've left the number up there as well. And it's there all year round. And additionally, if you wanted to ask them anything about their therapy or peer support services, there's an email address there on the screen if you wanted to email them. But they've got an absolutely extensive list of resources available. So all of those mentioned there, like addiction, bereavement, disabilities, to, do you need advice on reasonable adjustments, any legal, financial issues? And then there's a map on the side, and they've got a massive PDF of the different regions and the different support services that you can find with those regions. So they've got an extensive amount of information and advice and support there if you need it. And there's no harm sometimes just looking, so that okay, if things do get a bit tougher in the future, you know where to look. So I'd highly recommend having a look at it if you're struggling in any way at all. Something that the foundation schools often have is the Professional Support and Wellbeing Unit, or PSU. They're free as well, form of therapy, but they also do a lot of other things depending on where they're based. But they can do wellbeing services, exam support, personal coaching, mentoring, any career performance issues that you need some help with, workshops, and also like things to help support your career choices. So I think I went to one before about different specialties careers. They did one before, and you can refer yourself in some cases. Sometimes you need a supervisor to do it. But I could only find information on NHS England, but I know Wales does it as well. GMC, they also have a whole list of resources and support services on their website, and I've done a hyperlink there, but you can also Google that. And then the BMA have also got a kind of, a confidential, not-for-profit psychotherapeutic consultation service, and that's called Doc Health. So that isn't free, but they've got extra services that, if you wanted to have a look at or speak to someone, particularly for people who are in the medical profession, there's a lot out there, and even free things. So we've got lots of different apps. I'm sure most of you have heard of Headspace before. They sometimes have really quick meditations or things to help calm you, even things to help you sleep at night, just some sounds to help your mind go a little bit more blank. And then you've also got the Stay Alive app. That is a really good suicide prevention resource, and it just gives you some tools if to help keep you safe if you're in a crisis. Bright Sky is another free confidential mobile app, and it's really helpful in providing support and information of those who may be in an abusive relationship or concerned about someone that they know. And Mind, that is a mental health platform, and that helps to try and empower you to proactively improve your mental well-being. And then Zero Suicide Alliance, that helps with providing a range of free online learning sessions that provide you with a better understanding and signs to look out in those around you that you think might be struggling, and how you might be able to help them and get them to seek help. Try to find some lovely good things about working in the NHS and do some discounts. You may have heard of the blue light card, so it is a small fee, but you do get a massive amount of discounts. It's just knowing where to look, really. And that's like restaurants, food, drink, excursions, sometimes even holidays. The Pure Gym does an NHS discount as well. And there's the Cycle to Work scheme or Bike to Work, where it's sort of with your salary, it subsidises it so that you pay it off over time and you get a bicycle to bike to work with. So there's a lot of things out there if you do need to, if you find that someone is struggling or you yourself need help. And I would do a quick summary that basically, I'm just hoping at the end of this that you all remember that your own health is important too. And I can say all of these things about what to do, but it is really hard to do them. And recognising that we're human and we're looking after vulnerable people as well. So it's important that we look after ourselves. Take your breaks. I hope that's one thing actually that you take away from this, is that you do take your breaks when you can. And if you're struggling, that you know how to get support and resources that are available for you, and not to be afraid to ask for that help if you need it. Because like I said before, mostly everyone has struggled at some point, and they may look like they're okay, but that really isn't the case sometimes, and it's all right to not be okay as well and get help for it. And trying to have a life outside of work or medical school, trying to find things that you enjoy, or even just like little things that will help you get through the week if you're having a particularly bad time. So I'll end it on the main thing really, is that regardless of where you are and how you're doing, that there's always someone there you can talk to. So if you feel like you're struggling, please remember that there's always someone there. Okay, so thank you very much. I don't know if anyone has written anything, but I will stop my screen. If anyone has any questions, if anyone wants, they could please leave any feedback, let me know. If there's anything that you'd want for us to chat about again, or anything you want any answers to. But I just hope that we'll try and look after ourselves a bit more. And I can't say that much because I have days where I don't do it very well either, but I hope it's been helpful in some way for you guys. Okay, so any questions, just let me know. Or not, you don't, or you can just message or whatever. Oh, okay. You're welcome, guys. It's nice of you to turn up as well on an evening in the middle of the week, so thank you for listening to me ramble on. Lovely. Cool. So if there isn't any questions, just, yeah, I think they may. Oh, imposter syndrome. Ooh, that's a good one. I think most people would have it at some point, imposter syndrome. I think it's very easy to look at people around you who are similar and think they're coping better and doing better than you, and that you're not worth it and you're a terrible doctor. And I think sometimes you need to remember how far you've come and what you've been able to do and where you are. I mean, getting through medical school enough is really tough, and getting into foundation training, you can feel like you don't know anything, you don't know what you're doing, but you do inside. I think if it's a particularly big issue that's stopping you from getting ahead and working, that you talk to someone about it. I've had a similar colleague who used their professional support unit when they were in F1, just to kind of get an idea, why do they feel like they have imposter syndrome? Are there things that they can do sort of at their own thinking that are helpful? And sometimes it's okay to get extra help with that. But I think a lot of people, I think even me to a certain extent, I'm like, oh, everyone else knows what they're doing. Should I really be here, kind of thing? And that to an extent is normal and will hopefully get better with time. But if not, I think it's always okay to chat to people about it as well. It's not I'm sorry, I can't give this is exactly what you need to tackle it, because it's a really difficult thing. But knowing that you're not the only one, I'm hoping it is helpful. Do you suggest we do some past med before starting work, or are you difficult about all my finals knowledge? I think it wouldn't hurt. I would say the most of your learning will be on the job, and a lot of it will be learning how the systems work, how when you've got unwell patients, how do we escalate, how do we get in touch with all these specialties, and through that you learn how to manage the patients as well. I think when I first started F1, I was calling my reg or even SHO a lot of the time just to be like, okay, this is what I was thinking of doing, and so, and they're like, great, do you want to also do this or that? And even though on-calls are sometimes one of the worst shifts you can do, you do have good on-calls as well. I think that's where most of your learning is, and a lot of it is on the job as well. And if you've passed your finals, I think that means you've got enough in the bank there to get through the job. So I think it ties into imposter syndrome a bit, as you're like, oh, I don't know anything. But when you start doing it, you're like, actually, it is there. And you go through rough days. But I think if you've got time, do some past med. But I think a lot of it is also on the job. So try not to worry too much about it. And it is like a steeping kind of knowledge and experience and getting up that slope. But by the end of F1, you'll have forgotten what it was like to be a medical student. It's such a dramatic change, and you will all be completely, I mean, in fact, you're even here listening to a wellbeing lecture makes me feel like you guys are going to be okay. Yeah, so so hopefully, well, yeah, feeling like the imposter syndrome, that kind of thing, if that isn't getting you better time or impacting your care, then yeah, get some help with that. But I think a lot of people do have a bit of it as well. And that's okay, you're all welcome. I think I remember being so nervous before starting my F1, and actually just getting into it and doing the job was what I just needed to get to grips with it. And you forget all of that kind of anxiety before it. I think it ties into the imposter syndrome, because 3 months in, you're going to be doing all these things you didn't think you were ever going to be able to do. So have more faith in yourselves. You guys will be okay. And everyone has to start as an F1 at some point, so don't be afraid to ask for help. I hated having to do it, but I was just like, calling whoever, like, can I just check this with you? Is this the right thing to do? Because that's, you can leave. Sorry, my cat is looking at some birds. And be quiet. And then that is it, really. There we go. Making so much noise. I have to show you the cat if you're going to hear him. He's very fluffy. There we go. How do you handle difficult seniors? I think it depends on how difficult, and if you've got your team to support you. Often, as an F1, you'll be given sometimes the jobs to go request things or talk to different specialties, and you expect that you're sometimes going to come across a bit of a wall sometimes in their response. And it's kind of, if it's impacting patient care or it's stopping you from being able to do a management plan, often I would go straight either to my reg at the time, or Fosie, like a post-take order or something, go to the consultant and say, okay, well, in your plan, you suggested you wanted this. However, when I did this, they said this. And then either they would then escalate it themselves and get their registrar to do that job, or they would then go and speak to that senior. There's complex relationships depending on the department you are. I think it can be difficult, but you've got to try and fight your own corner as well. And that's something that comes with a bit of time. And if it's getting to a point where, like I said, it's impacting patient care or bullying or abuse, then that's when you need to start escalating those concerns. You do get you will get grumpy people no matter where you work. And it's just trying to navigate it. But you'll get it, you'll understand it. And then if it's a particular person, everyone else will have dealt with them already, and they'll be able to give you that support, hopefully, as well. So yeah, there are definitely lots of stories out there, but you got to look after yourself as well when you get to that. And it often isn't personal if they've been mean to you, and it can be really hard not to take it personally, but it isn't about you. It's clearly something else that's happening with them, and we all just try to do a job, and remembering you're doing this for the patient. So I hope that's helpful. Okay. So I guess I don't know if they'll be sending feedback out or anything like that, but if you've got time, be really grateful, and best of luck. You guys are going to be all okay, and you'll be completely different people in a couple of months' time whenever you start. Okay, so just have some confidence and faith in yourselves, and you guys will be okay. Okay, lovely. Thank you, guys. I don't know if there's anything else. Lovely. Okay. I think Kirsten's gone. I don't know where she is on here. So I guess we'll end that there then. Okay. All right. Take care, guys. If you want any more questions, I can leave my email with the team, and they can send that out as well. And hope you have a lovely rest of your evening. Do something nice for yourselves, whether it's a bath or if you've eaten dinner yet, things like that. Yeah. Okay. All right, bro. Thank you.